Welcome to the latest episode of the Beauty and the Beast podcast. As always, I'm Sam Jejurikar, a plastic surgeon in Dallas, Texas, and I'm joined by the illustrious Salvatore Pacella, plastic surgeon in San Diego and La Jolla, California, and a professor at the Scripps Clinic. How are you doing today, Dr. Pacella?
Fantastic.
Well, today we're going to talk about a topic that Dr. Pacella and I don't always see eye to eye on, and that's about facial fillers versus facial cosmetic surgery. We're going to talk about whether or not you're ready to get a facelift or whether it's okay to keep getting fillers, who are patients that we think are appropriate candidates for non-surgical treatments versus patients that we think necessarily need plastic surgery. So, Sal, I know we've talked about this quite a bit and the extensiveness by which we utilize fillers in our practice. In general, who do you think is a good candidate for getting facial fillers?
So, just let me start off by saying, as a surgeon, I like to perform surgery. When you're a hammer, the whole world's a nail, right? So fillers, I think, from the technical aspect of things, I think, it's not as fulfilling as doing surgery. There's not a dramatic change, but they do have value. And I think for patients who are younger, patients who are not looking for a tremendous amount of downtime, they're afraid of the downtime, I think fillers are a good option. I am not a big fan for fillers in older patients. And I think, that's possibly where we differ a bit. I tend to see in my community many times a lot more 60, 70, 80-year-olds. And they come in and they say, oh, I just want to use a little filler. And it's really, by that point, you've passed the ability to treat anything by filler. So
yeah, for sure. And that answer was actually not as far off from what I typically think. So maybe this won't be as controversial, but
I think we can make it controversial.
I, as a surgeon, also don't like doing fillers, and I don't personally do a lot of fillers, but I do recognize that there's always a trade-off between how effective a treatment is going to be versus what the downtime of that treatment is going to be. And although it's not always the truth in general, the more effective a procedure is, the longer the downtime is. And so when we start talking about things about facial fat and facelifts, which we're going to touch on in a little bit, there's some downtime associated with it. I do think facial fillers have a role for people that are not willing to put in the downtime. So you had sort of mentioned that younger patients might be a better candidate than older patients. Why is that?
Well, so I think a lot of it has to do with the skin elasticity and the skin consistency, right? So in general, a good rule of thumb is the older you get, the more sun damage you have, the more elasticity you lose from your skin. So fillers do nothing to treat fine wrinkles, okay? Fine sun damage wrinkles in and around the mouth, in and around the eyelids. That sort of crepiness of skin won't do a thing with fillers, right? If you're looking for adding volume, fillers can be a very good option, right? And for me, those are almost exclusively in the lips and in the cheek area. Mm-hmm. I will say something very controversial here. Fillers in and around the eyelids, I never do them. I dissuade people from doing it. In doing a tremendous amount of eyelid surgery, I see what damage fillers can do in and around the eye. And more importantly, if you decide to undergo a lower blepharoplasty or a lower lid procedure in the future, fillers only complicate matters. They're exceptionally difficult to dissolve. They can get lumpy, they can get bumpy, they can scar tissue down. Sometimes I just throw my hands up with it.
Okay. Just throw them up in the air and wave them around like you just don't care. But I don't even think that's that, fillers in the lower eyelid in general have been a complicated area for plastic surgeons. I think for many years, we even struggled to figure out what that right filler would be. When we use hyaluronic acid fillers, which are the most common fillers in plastic surgery, you can get something called a Tyndall effect, which can lead to bluish discoloration. So sometimes it doesn't even look that good. Lately, the injectors that I work with have been using PDGF or Ariescence, which is an off-label indication of it, and they've seen some initial results. But now that's turning into a controversial area with the FDA recently saying they can't even recommend it as an off-label approach. So we've pulled back from doing that as well. My general philosophy is that when patients are in their 30s and their 40s, when they're looking for volume, when they're looking for fine lines that can be filled, filling agents can be very effective. Um, as they get older, there's a real danger that, and we've seen this a lot in society, that um, people that are, you had talked about, the whole world being a nail and we have a hammer. Well, over 50% of the injectables done in the United States are not done by physicians. And given that that's their only tool, they try to do more lifting with fillers. I do think that when you try to do a lifting sort of procedure with a filling agent, so you start putting in lots of syringes into someone's cheeks, lots into their jawline, they look strange. And it's not an aesthetic that most of us like.
Yeah, and to me, a concept I live by when it comes to fillers is less is more. Let's be honest. We can, if you're a great salesperson, you can sell 5, 6 syringes to a patient in one sitting. Is it going to be effective for them? Possibly. Is it going to be extremely expensive? Yes. Is it going to do what you think it's going to do? Possibly, possibly not, right? And so I think a lot of patients experience this sort of filler fatigue, right? You go in every 3 months, every 8 months, every 12 months, you get more filler. It does less and less every time. And it's just a constant cost for patients. To me, they could spend a few more $1,000s and do a more permanent operation, a blepharoplasty or fat as a filler. To me, the best filler out there is your own fat.
For sure. Um, let's talk about facial fat because I think that's a really nice thing to talk about. What are the benefits of facial fat? Why do you think it's a better filler than an off-the-shelf hyaluronic acid product?
Well, because it's your own tissue, right? And so, when we're grafting, so years ago, we used to do 20, 30 years ago, we didn't have a lot of science behind fat transfer. Most surgeons would take it out of the body, suck it out through liposuction, rinse it a little bit, and inject it back in. And that had a very low yield, right? So now we have technology that can really concentrate the fat. It can get the stem cells into the injection. We have ways of reducing the size of the fat molecule that goes in.
Mhm.
And so when you inject it sort of in the periorbital region or the eye, we can do little tiny particles compared to what we would do, say, in the breast, right? And so to me, it has the benefit of being able to be placed deep, superficial, and everything in between.
So do you think that there is a role for facial fat that would eliminate off the shelf fillers in for patients? For instance, if a patient comes to you for facial fat and they ask you, Dr. Pacella, does this mean I'm not going to have to go to my injector anymore to get my lips done or to get my cheeks done? What do you tell them?
So I tell them fat is just like you. It's your tissue.
You
If you
call your
lose,
patients fat?
what's that?
You're calling your patients fat?
Just like their fat, just like their fat. So if I take it from the abdomen
Yeah.
and they lose weight and I inject it into the face, they're going to lose it in their face, right? And there's something to be said as time goes on, just like it would in your body anyway. You can lose the volume of fat. It's a natural phenomenon, right? So does it negate the fact, hey, I do this fat transfer procedure to my lips? Am I never going to need anything further? Possibly not. But the longevity of it, I think, is going to be much longer.
Yeah. And this is where I differ from you some. I think that I think fat is great as a foundation. I think fat has growth factors in it that help the overall quality of the skin. I don't find the results of superficial fat, other than in the lower eyelid and the temples, to have the same predictability in results as I do as when we inject fillers. So what I'll tell patients is, look, if we're going to do a facial fat grafting procedure, there's some morbidity involved. We're going to harvest the fat. There's going to be a little bit of bruising, a little bit of swelling. We're going to inject the fat into your face. There's going to be some morbidity involved with that. You're going to have swelling that's going to be significant for a week or two. We might use anesthesia given the amount that we're going to put in. And then you'll get, of the 50 cc's that we distribute in your cheeks and your marionette lines and your nasolabial folds and your temples and your lower eyelids, we're lucky 60, 70% of it will survive, but that'll serve as a great foundation. It will not eliminate the need for fillers in your practice, in your life moving forward, but maybe you'll need it less frequently and you'll need less of it. But I haven't found fat to be effective in the lips. Maybe I'm just doing something wrong, but whenever I tend to inject fat into someone's lips, it just doesn't stick around. I find that when I'm injecting nasolabial folds and I'm injecting marionette lines, it's not as predictable as superficial injections with filler.
Yeah. And I think, in the lips, there is a tremendous amount of recovery with that. I mean, I'm oftentimes doing fat injection to the lips in the setting of a lip lift, where we make a small incision underneath the nostrils to pull the lift up or to pull the lip upwards.
Mhm.
I oftentimes am doing that with a facelift. And the recovery, they're going to be recovering for the facelift anyway. They might as well be able to recover with the fat. And I tend to overcompensate a bit, knowing that they're going to drop down a bit.
Mhm.
But again, I think the recovery is substantial. The softer the tissue, the more recovery.
Yeah. Just touching on this topic of filler fatigue one more time, society does tend to have a series of cyclical trends that it goes through. And I'm really happy, as I'm sure you are, to see that people are not getting as much filler put in as they did a few years ago. One of the big trends that I'm seeing are patients coming in who now want their lips dissolved. You've seen these trends where people are getting 3 or 4 syringes of filler. And now we have a whole protocol by which they come in for 3 different treatments to actually get their filler dissolved before we'll actually put in subtle amounts of filler.
Yeah.
Are you noticing the same thing in Southern
Well, I
California?
think, any time where you're in the process of dissolving a filler, it's unpredictable and it's going to be challenging.
Yeah.
And that's a major reason why I'm not a big fan of them.
Yeah. And one thing you and I have talked about is as we do facelift surgery, how we find filler in the deep soft tissue. And there can be a danger with some of the more semi-permanent fillers for scarring. So, I think in the end, you do have to be careful and not try to do too much with fillers. But I think there's still a role if it's done in concert with a plastic surgeon. You agree with that?
Agree. Agree.
Okay. So, any take-home messages you want our viewers to get?
I think the important thing to understand when you're talking about fillers, the costs and the predictability. So if you're okay with both of those, then fillers are for you.
Yeah. And for me, I would say, don't try to do too much with fillers. Don't try to lift your tissue with fillers. But if you're filling lines, adding a little bit of contour, getting rid of some dark circles, it can be a good thing. Cheers.
Thank you.